Hello and welcome. Today we'll be discussing bladder cancer, a disease affecting the organ responsible for storing urine. This video aims to provide a comprehensive overview of bladder cancer, covering its causes, symptoms, diagnosis, treatment, and more. Understanding this condition is crucial for early detection and effective management. So, what causes bladder cancer? While the exact cause remains unknown, several factors significantly increase the risk. Smoking is the leading cause, as tobacco smoke contains carcinogens that are excreted in the urine, damaging the bladder lining. Exposure to certain industrial chemicals, particularly those used in the dye, rubber, leather, textile, and paint industries, also elevates the risk. Chronic bladder infections, long-term use of urinary catheters, and certain medications, such as the diabetes drug pioglitazone, have also been linked to an increased likelihood of developing bladder cancer. Additionally, a personal or family history of bladder cancer may increase susceptibility. Let's delve into the pathophysiology, or how bladder cancer develops. The disease typically begins when cells lining the bladder undergo genetic mutations, leading to uncontrolled growth and division. These abnormal cells can form a tumor on the inner surface of the bladder, most commonly originating from the urothelial cells, also known as transitional cells, which make up the lining. As the tumor grows, it can invade deeper layers of the bladder wall, potentially spreading to nearby lymph nodes and other organs through a process called metastasis. The severity of bladder cancer depends on the depth of invasion and the extent of metastasis. Now, let's discuss epidemiology. Who is affected by bladder cancer? It is the sixth most common cancer in the United States, and men are significantly more likely to develop it than women. The risk of bladder cancer increases with age, with most diagnoses occurring after age 55. Caucasians are more frequently diagnosed than African Americans, though African Americans tend to present with more advanced disease. Geographic location also plays a role, with higher rates observed in industrialized areas due to potential exposure to carcinogenic chemicals. What are the signs and symptoms of bladder cancer? The most common symptom is hematuria, or blood in the urine. This blood may be visible, giving the urine a pink, red, or cola color, or it may only be detectable under a microscope. Other symptoms can include frequent urination, painful urination, a feeling of urgency, and back or pelvic pain. It's important to note that these symptoms can also be caused by other conditions, such as urinary tract infections or kidney stones. Therefore, it's crucial to consult a doctor for proper diagnosis. How is bladder cancer diagnosed? If symptoms suggest bladder cancer, a series of tests will be performed. A urinalysis can detect blood or other abnormalities in the urine. A cystoscopy involves inserting a thin, flexible tube with a camera into the bladder to visualize the lining and identify any suspicious areas. If abnormalities are found during cystoscopy, a biopsy, the removal of a tissue sample for microscopic examination, is performed to confirm the presence of cancer cells. Imaging tests, such as CT scans, MRI, and bone scans, may be used to determine if the cancer has spread beyond the bladder. Bladder cancer is classified based on several factors, including the type of cell involved and the extent of the cancer's spread. The most common type is urothelial carcinoma, formerly known as transitional cell carcinoma. Bladder cancer is also staged, with stages ranging from 0 to 4. Stage 0 indicates that the cancer is confined to the inner lining of the bladder, while stage 4 indicates that the cancer has spread to distant organs. Furthermore, bladder cancer can be classified as non-muscle invasive, meaning it has not spread beyond the inner lining, or muscle invasive, meaning it has spread into the muscle layer of the bladder wall. This distinction is crucial for determining the appropriate treatment approach. Treatment for bladder cancer depends on the stage, grade, and type of cancer, as well as the patient's overall health. Treatment options may include surgery, chemotherapy, radiation therapy, and immunotherapy. For non-muscle invasive bladder cancer, transurethral resection of bladder tumor, or TURBT, is often performed to remove the tumor. Intravesical therapy, which involves delivering medication directly into the bladder, may also be used. For muscle-invasive bladder cancer, radical cystectomy, the surgical removal of the entire bladder, may be necessary. Chemotherapy and radiation therapy can be used before or after surgery to kill cancer cells or shrink tumors. Immunotherapy, which helps the body's immune system fight cancer, is also becoming increasingly common. Can bladder cancer be prevented? While it's impossible to guarantee prevention, several steps can significantly reduce the risk. The most important is to avoid smoking. Quitting smoking reduces the risk of bladder cancer and other health problems. Avoiding exposure to industrial chemicals is also crucial. If you work in an industry with known carcinogens, follow safety guidelines and use protective equipment. Drinking plenty of fluids helps to dilute urine and flush out potential carcinogens. A healthy diet rich in fruits and vegetables may also offer some protection. What is the prognosis for bladder cancer, and what are some recent research advances? The prognosis varies depending on the stage and grade of the cancer, as well as the patient's overall health. Early detection can significantly improve the chances of survival. Recent research has focused on developing new and more effective treatments, including targeted therapies that specifically attack cancer cells and immunotherapies that boost the body's immune response. Researchers are also exploring new diagnostic techniques, such as liquid biopsies, which can detect cancer cells or DNA fragments in the blood. These advances offer hope for improving the outcomes for patients with bladder cancer. Continued research is crucial for developing even better ways to prevent, diagnose, and treat this disease.